So what are the various injuries that can happen and how do I prevent them? So the first one is going to be, of course, the hysterectomy that I've already spoken. I've already mentioned what are the potential locations where it can get injured. So IP ligament, the uterine artery, and the uterosacral ligament ligation. The bigger question is how to prevent these injuries. So the golden rule is, or the most important rule during cesarean section or during hysterectomy is to dissect the UV fold and push the bladder down. So whenever you dissect the UV fold, that is your visceral peritoneum, and whenever you push it downstairs, the bladder, the lower down, the bladder goes down, and the ureters behind they also go down with it because they are going down with the trigone. This ensures that you are well away from your uterine arteries and also from your uterosacral ligaments, and it also is going to help you prevent any bladder injury. So dissecting the UV fold is a very good technique. Once you dissect the UV fold, make sure that whenever you're taking the uterine artery clamp, it has to be immediately ligation. Uterine artery ligation has to be immediate lateral to the cervix. So the cervix that is there, you have to immediately ligate it lateral to it and not go too far away from the cervix, because the more you go towards the lateral pelvic wall, the chances of injuring the ureter are very important. So first of all, dissect the UV fold and then take the uterine arteries. Do not do it without dissecting the UV fold. And lastly, pull the uterus or give traction to the uterus vertically upwards. So basically, when you pull the uterus vertically upwards, similarly, the bladder is going to get pushed down and hence the ureter is also going to stay down. And it is going to be much easier for you to apply clamps. So the first thing that we do whenever we are doing an abdominal hysterectomy, an open abdominal hysterectomy, is that we put two straight clamps. Those straight clamps, they are very important because they help me in grasping the uterus and also to pull it upwards for it to be easier for me to be able to operate inside the pelvis. So very important that I do these things, and these things are going to significantly reduce the risk of ureteric injury. The next is during TLH, that is during laparoscopy, energy sources. Energy sources can be any monopolar cautery, bipolar cautery, harmonic scalpel, several energy sources. So energy sources related injury, and this is very dangerous.